Doing this, he got the credit and was told that the broomstick was his idea. So he did not get the credit, but again, remember that title I gave you. It happened, it hurt, but he refused to be bitter. Now, again, this is from one of my Facebook friends, Bunny Bronson. I'll give a shout out to her. This was her grandfather. And we thank God for that wonderful Black History moment. And we should all take that into account and to remember that as we go, along our way. Thank God for that. Now, of course, we always like to do a recap of last week's show. And again, I have in my studio with me Dr. Lisa Rembert. She joined us on last week, and she's here on today. Can you say hello?
Hello, and thank you for having me.
Well, thank you so much for coming in again. I appreciate you. This is, again, my new friend. We thank God for her willingness and desire to come in and assist us and give us some more information from the mental health professional viewpoint. Now, again, Dr. Rembert, she's a licensed clinical professional counselor, and she has her doctorate degree in clinical psychology. She has over 25 years of experience working with people regarding life issues. And she is presently the pastor of Prayer, Praise, and Power Healing and Deliverance Ministries.
Amen.
Amen. So she is not only a mental health professional, but a Christian mental health professional. And we're grateful again for you being here with us on today.
Thank you very much.
All right. Did you enjoy yourself last week?
Yes, I did.
Okay. Well, let's try to recap about last week. Last week, we wanted to get your viewpoint of what the mental health professional, what their role is in our church.
Yes.
And we talked about that a little bit. You want to give us a recap?
Yes, we did. We talked about how the mental health professional can be an assistant to the pastor in helping people find the resources that they need for their mental illnesses, in being able to teach congregational members what to look for, what to do, those type of things. And the biggest thing is to realize that the mental health professional actually is not against the pastor, is not against the gospel,
Awesome.
but that is part of it.
Yes.
And that we need to minister not just to the physical, but to the mental part of the person, because we're dealing with whole people. And we deal with the spiritual, we deal with the physical, but we kind of shy away from the mental.
Yes.
And that's there too.
Yes, it's there too. I'm so glad you brought out those points because, again, we wanted to, let the listeners know, the church world and everyone know that, no, we're not pushing out the word. We want to take what we learn professionally and intermingle it. You make sure we use what is being taught in that church as well. Bring this in together and make it work,
Yes.
for us. And we thank God for that because it is so important. And we're just faced with so much. I actually, on this morning, I was looking at some of the comments from when I put my post up about today's show.
Yes.
And someone said to me, can we move to another subject? I said, well, of course I have to go as the Lord leads me, but this is so important. Mental illness, it's there.
Yes.
And we can't overlook it. It may sound like we're beating a dead horse. I don't know if some feel that way or not, but we've got to bring this awareness, and that alone lets me know that it has to be
Yes.
it has to be brought to the forefront when you say, can we move to something else? So, I just thank God for this time, this opportunity. But again, as I always state, I want to bring the awareness, but also we want to bring solutions as well, of what we can do to help. Now, this week's topic, I did a poll, of course, again, and I wanted to know how to recognize mental illness, whether or not, the listener, as individuals, do we even know what to look for? There was actually something that you said, Dr. Rembert, on last week. You said we have to know what mental illness is.
Exactly.
We have to know what it is, and how do we recognize this? So I sent you, a few questions to see if you could help us, from the mental health professional standpoint, and let the listeners know what do we look for?
I think we have to think of it in this manner. Just as there are many physical illnesses. There are many mental illnesses. But there are also some general things that you can look for in a person. The number one thing that you look for is that person acting the way they typically act? That's something that you look for right away.
Okay.
If you have a person who, for example, who maybe normally is neatly dressed, they're clean, their hair is in place,
Okay.
and all of that, and you notice that that's out of place, not because they were running, not because they were in a hurry, but even in a regular service, for instance, they're coming and they're disheveled and they're not themselves. That right there is alarming.
Okay.
You need to pay attention to their appearance.
Okay.
It matters. How is their mood? That's important. If there's somebody who is normally upbeat, happy, they're smiling, they're talking with everyone, they're cordial, and now they're doing the opposite,
Okay.
that is different for them. Just like if you have someone who is normally quiet and laid back, and now they're loud, they're blurting out, they're more active,
Okay.
kind of even hyperactive acting.
Okay.
That's different for them. So what you're looking for is a comparison.
Okay.
Is this person who they typically seem to be? That's one thing. You also need to look for bizarre behaviors.
Ah.
Are they doing something different? Sometimes you see a person in the church, I've seen this before. Maybe they get up, they're moving all over during service. I don't care if they're praying, I don't care if they're preaching,
Okay.
and they're not paying attention to what's going on.
Okay.
Maybe they're going around and they're talking to different people during service. They're in places, maybe they're in the choir stand and they should be sitting down. Just different behaviors that are bizarre. You look
So
for
it's like
them.
out of order?
Out of order.
Okay.
And this is a person who normally is in order.
Okay.
Okay. Also, what you see in mental illness, you may see a person talking to themselves. That goes along with that bizarre behavior. I'm not talking about praying. I'm not talking about praising.
Okay.
I'm not talking about speaking in tongues.
Okay.
I'm talking about having a conversation with themselves.
Wow.
And a lot of times, people who are mentally ill, they know they're talking. They know they're having a conversation.
Right.
But sometimes they see people you don't see.
Okay.
They believe that they're there.
Ooh.
And crazy as it sounds, a person's perception is their reality.
Yes.
And that reality could be wrong. So you want to look at that.
Okay.
But then there are other mental illnesses, and so you may notice a person who maybe they have depression.
Okay.
A lot of times we think depression has to do with, are they crying? That person may not be crying.
Right.
They might be extremely irritable. They may have a depressed mood or have some form of sadness, but they might not be crying.
Okay.
What you want to pay attention to, again, is are there changes in them that are not normal for them? Are there changes in this person's eating?
Okay.
Are there changes in their sleeping? Sometimes we think it means they sleep a lot. No, they may not sleep at all.
Okay.
They may sleep a few hours and then they're up kind of agitated, or you listen to their talk. I've been up a few days. I can't get sleep. That's not normal. Then physically, you may just pay attention to weight.
Okay.
Do they lose weight, a lot of weight quickly? That might be a sign.
Okay.
Okay, that could be physical, we know, but those things also happen when they have mental illnesses. Maybe
Now, can I ask you a question? Is it just
Yes.
the weight loss
it could be weight loss or gain.
weight gain? Okay.
Could be weight loss or gain.
Okay.
Then you also may have a loss of interest. Maybe you have a person who they're usually involved in the ministries, or they're in the choir, or they're on the deacon board, they're in the usher board. They're involved in something, and all of a sudden, no, I'm not interested. No,
Okay.
thank you, I don't want to go. No, I don't want to be called. No, I'm not showing up in Bible study.
Okay.
No, I'm not in Sunday school. That's a loss of interest. That can be a symptom that there's some depression going on.
Okay.
You look at the fact that are they withdrawn? Do they lack energy? All these are symptoms.
Okay.
Do they have difficulty making decisions? Maybe they're assigned to some ministry and you say, I don't know what the problem is. Normally they follow through, but nothing is getting done.
Okay.
They can't focus on it. The program's coming this Sunday. still don't know what's happening. It could be something going on.
Okay.
We need to pay attention to that. Then there's also maybe somebody is manic or has like excessive energy. They can be irritable. They can have elevated mood.
Okay.
They might be what we call grandiose or big thinkers, thinking they're big.
Okay.
Sometimes people can go extreme with that. They may think that they're something bigger than they are.
Okay.
They may think that maybe they're not the pastor, but they might begin to act like they are the pastor. They may believe they are. Or some people have delusions. And
Okay.
those delusions can have a religious theme to them.
Okay.
I'm the son of God. I'm the sister to God. I'm God's mother. You know, they believe that. Now,
Okay.
we know it's not true.
Right.
But when you start hearing those kind of things or you see those kind of things, that says to you something is wrong.
Okay.
Also, pay attention to the person's speech. Sometimes they talk a lot or they have what we call a flight of ideas or racing thoughts.
Okay.
They're on one topic, they move to the next topic and the next topic and the next topic. They might look like they have a whole lot of energy. They may be talking very fast. Those are symptoms.
Oh, wow.
They might get distracted by things. Maybe
Okay.
the choir is saying one thing, now they're over here looking at something else, and now they're paying attention to somebody's purse, and they're watching somebody's clothes, and while maybe the
Wow.
prayer is going on.
Okay. Okay.
So these are symptoms that you're looking at.
Yes.
Or their excessive need or involvement in pleasurable things that can be dangerous.
Such as?
Such as maybe that to them maybe this is a person who normally is kind of sensible, but now they're talking about, well, I'm gonna go bungee jumping and I'm gonna be doing this or I'm gonna be swimming this. They can't swim. They're driving fast. They're just doing a lot of behaviors that are not typical.
That is not typically
That
what
is
they
the
would do.
key.
Okay.
Looking at what's not typical. But not just what's not typical for them all the
Right.
time,
Right.
but you may also look for what's not typical of the average person. That's how you also know, because maybe it's somebody you don't know well.
Okay.
If that's the case, then you say normally, for instance, if someone dies, most people become depressed in some kind of way.
Yes.
Some sad some kind of way.
Okay.
But this person's reaction is the opposite
Okay.
to what typically people will do.
Okay.
Those are symptoms.
That's okay. That's interesting. I'm jotting down things that you're talking. But go ahead.
Those are symptoms, and so you want to be aware of that. Maybe you have somebody, and this is a good thing in the church, especially when you're talking about grief. And you start saying, well, I know, I'll use myself. I know Sister Rembert lost her mother, but now she's very angry and she's fighting with everybody and everybody's getting on her nerves. And people start, I'm going to leave her alone. That is a symptom.
It's a symptom.
Yes.
Yes.
That's a symptom.
Can I interject something here?
Yes.
I mean, you're giving us some wonderful things to look at and things that are alerting us. Now, let's go back to, like, even an example you just gave of someone in the church who've lost someone.
Yes.
Now, I know that everybody reacts differently.
Yes.
To different situations in their life, whether
Yes.
it's a loss of someone. So, even, in that, why do you, and I know you're giving us symptoms, but I have a question. Why does it seem like, for instance, the church, okay, they don't think that they should get counseling for that or any kind of help for that? What do you think should happen?
They need it. Sometimes people need it.
Okay.
Some people are fine. Some people can process that. Let me back up. Sometimes they can process things, and sometimes they can work through their grief and have closure just by going through the whole process of the funeral,
Okay.
those kind of things, because really that's what it's for. The funeral is really for the people who are still here.
Yes.
It's not for the people who died.
Exactly.
So a lot of times after we've done that, I think that we just become insensitive. I don't think that we purposely forget about the person,
Okay.
but we move on with our lives.
Okay.
And what you have to realize is for most people, they are focused on the things that concern them. And so if you're the one who lost the individual, then that's heavily on your mind.
Yes.
But everybody else has moved on. They
Yes.
think it's over.
Uh-huh.
Some people can grieve, they can let that out, and they can go on. For most people, it's a process.
It's a
and
process.
it takes time. What's important is if during the grieving process, whether it's 6 months, whether it's a year, however long it takes, if during that process that person is no longer able to function,
Okay.
then that's when they need a lot of assistance.
Okay.
Okay?
Okay.
So that's what makes it important.
Okay.
Now, there are things that we do. Just like I said, we have funerals. Sometimes we do things to remember the other person who died.
Yes.
I would like to say what happens a lot, we tend to say, just get over it.
Yeah.
They're dead, get over it.
Right.
No, get through it so that you can still have them.
Thank
so that
you.
you are able to talk about them and they become a part of your everyday living because they existed in your
Yes.
life. They had
Yes.
an impact.
Right.
So that's what's
and you
important.
can't push out the memories that you had and
No.
all of that. But I'm glad you say not get over it, but get through it.
That's it.
Because unfortunately, I learned when I was in high school, I lost my brother, and it was a tragic death. His life was tragically taken from us. He was actually murdered.
Okay.
And I was young at the time, and it devastated me. Now he was my only brother.
Yes.
It devastated me, and I'll never forget one of the young ladies at the church that I was attending at that time. She had lost a number of siblings.
Yes.
And she came up to us and she ministered to us and she said, you have to release this,
That's
you know, let it out. If you got to cry,
That's
do
it.
what you have to do so it won't be bottled up inside. And, she told us, you don't get over it.
No.
You just get through
You
it.
just get through it.
And, my brother's death was the first, close personal death that I had.
That's it.
And, since then, I've experienced other deaths in my family, but I've always remembered that, that you go through it.
Go
You
through
don't
it.
get over it.
No.
And, still to this day, he passed in 1983. I still miss my brother.
Exactly.
And sometimes I cry.
Exactly.
Sometimes, but I don't cry as much as I did.
Exactly.
That's the process of going through it.
Exactly.
But, I thank God for that. I have a couple of questions, actually, that I want to ask you,
Yes.
Dr. Rembert. I had someone to inbox me. And this question is actually from Janice Jackson, one of my good friends.
Okay.
She said, I'm wondering if people with mental illness are even aware or realize the state that they're in. So with that being said, she wants to know how can they get help if they're in denial?
Okay. No. A lot of times they don't know it.
Okay.
Okay. Because kind of like what I said earlier, their perception is their reality.
Okay.
And so no, a lot of times they don't know it. The way you help them, you have to approach them. But it's important who approaches them and how they approach them. People with mental illness, especially if it's a severe mental illness, tend to listen more to people they're comfortable with.
Okay.
If they feel like the environment is safe and warm, they'll listen, they'll talk with you. If you're dealing with somebody who has a severe mental illness, such as schizophrenia,
Okay.
they really need to know what's going on. So it's important to be open with them. It's important to answer their questions. A lot of times I've seen people with schizophrenia want to know what notes I'm taking.
Okay.
I let them see them.
Okay.
But I also talk to them about what's going on. So it's important for you, family members, church members, friends, to talk to them about what you see.
Okay.
Not to just say you need help, but to explain to them that they're not as they normally seem.
Okay.
And that their behaviors are a lot different. And to kind of point them out. I've been noticing that normally you like to keep your hair fixed and it's not.
Okay.
I've been noticing that you've been up for 2 or 3 days and you're not getting the proper sleep. And I really think that you're becoming sick.
Okay.
That's the way I tell them. I think you're becoming sick.
Okay.
They listen more to people they trust.
Okay.
When you talk to them about, how you notice that they're sick and how to help them.
Okay.
I would like to help you.
Okay.
If you would let me, I would like to go with you to the doctor or to the hospital, because you can take right to the emergency room. You don't even have to worry about, do I know the doctor? You don't have to know them. You can take them to the emergency room,
Wonderful.
and they will assess them.
Okay.
So it's important to create the right environment for them.
That's it right there.
They get agitated very quickly.
Okay.
A lot of times they're more afraid of you than you are of them. Because, again, they have delusions going on.
Okay.
Sometimes they have paranoia going on.
Okay.
And think people are out to hurt them or in some kind of way. And so it's important to say to them, I'm trying to help. But you need calm is the environment, including your voice,
Okay.
your mannerisms, whether or not the way you look at them, all that calms them. Sitting down is calming
Okay.
to them. Rather
Okay.
than standing up over them, I'm going to take you here. No, sit down.
Okay, and just have like a
One-to-one.
lateral conversation,
That's
one-to-one.
correct.
Okay.
That's correct. And a lot of times that helps. Now, another thing people need to know, especially if it comes to a severe mental illness, depression, and suicide, it's very important to know that you need to look at what's the risk of harm for this person.
Okay.
That needs to be your number one priority. They may be get mad with you. They may stop speaking with you. They may feel like you're no longer their friend. You cannot let that keep you from helping them.
Beautiful.
Okay? This thing is about their safety.
Yes.
A lot of times, once they've gotten help, then they realize you meant them well.
Okay.
But if you're not in your right mind, then you're not going to think clearly.
Yes.
And you may feel like you're just mistreating me.
Okay.
Okay? And so sometimes you're able to take them and go with them to the hospital. If not, call the ambulance.
Okay.
I suggest the ambulance more than the police, even though some people do call the police.
Right.
But I think it's just a matter of,
That's probably less threatening.
less
Okay.
threatening for them, because that goes along with you're sick.
Okay.
Okay? And then you can take them there. Remember that they, too, are fighting the stigma of mental illness.
Right.
Yes.
And the embarrassment.
The
of it.
embarrassment. And there's
Wonderful.
a feeling of defeat
Okay.
and inadequacy, especially for people who maybe they're dealing with depression as opposed to schizophrenia.
Right.
Then there's that, I thought I could do this on my own.
Yes.
I don't really need this kind of help.
Yes.
I'm embarrassed that I have to do this.
Right.
All of that.
Right. And then it's probably them coming into the realization, they've probably been fighting it for so long.
Yes.
Dealing with depression, but not recognizing or not accepting it, should I say?
Yes.
And then you come into that embarrassment, So, this is wonderful. I hope the people are listening, especially you that were on Facebook that gave your input. Dr. Rembert, I truly appreciate your professional expertise and your professional knowledge that you're bringing to this, because, I wrote down so many points, different things to look for, and I think it's so important because you brought up something, how you said the calmness, to be calm when you approach them. And I think it's important because that is going to be your first step before you can even try to get them to getting professional help.
Yes.
So the whole concept of today's show was, how do we basically, as non-professional people, how do we approach this situation? How do we handle it? Because we don't have all the degrees that you have. Thank God for your degree.
Praise God.
And the knowledge that you have in that aspect. So as lay people, if I could say, how do we handle that? And you've given us some awesome points, to do. And again, I'll say, be calm about it when you
That's
approach
it.
them. And I think that would help, you to get over to them and to get through to them. And I believe we can move forward from that. I thank God for this opportunity and this time. And, as always, like my time runs out on me, but, I thank God for this. We'll be reposting this show so that everyone can, who weren't able to listen live, can be able to look back and go on YouTube and listen. We'll let you know when it's up. Now, I have to move on to my People in Need campaign announcement for today. We have on today Respond Now of Chicago Heights, Illinois. Again, that's Respond Now of Chicago Heights, Illinois, and the location is 1439 Emerald Avenue in Chicago Heights, Illinois, 60411. Their number is 708-755-HELP, 708-755-HELP, H-E-L-P. And if you would like to be a sponsor or make any donations to Mind, Body, and Soul, we definitely welcome it, and we encourage you to send it to P.O. Box 288-382, 288-382, Chicago, Illinois, 60628. Or you can contact me at 505-552-2638. And if the Lord has blessed you in any way, you benefit from this show and any of the previous show, we welcome any donations or sponsorships of this program. And Dr. Rembert, again, I thank you again.
Thank you
for joining us on today. I tell you, you're a godsend, and I thank God for you and taking out the time and coming to join us and to enlighten us. This has been a wealth of information that I've even learned on today,
Thank God.
and I'm so grateful for it. And I'm sure the listeners will definitely be blessed by this. And I have to end with my ending scripture today. 1 Thessalonians 5:23. And the very God of peace sanctify you wholly. And I pray, God, your whole spirit and soul and body be preserved blameless unto the coming of our Lord Jesus Christ. And we thank God again for this wonderful session on today, enlightening, I tell you. And, God, he wants his people to be informed.
Yes, he does.
He wants us to have the knowledge and to understand what is going on around us, so that we can better assist and, help the work of the kingdom. And thank you again. And I pray that you would join us again on next week. Tune into Mind, Body, and Soul next Wednesday. Blessings.
You've just been listening to Mind, Body, and Soul with Annette. Host Annette Harris provides biblical and psychological understanding for your everyday concerns. Need more insight? Visit her Facebook page at Mind, Body, and Soul with Annette Harris. And please be sure to tune in again next week for Mind, Body, and Soul with Annette.
I'm pressing on the upper way.